Good morning, everyone. Welcome, welcome. We're just waiting a few more minutes to let folks in. Our Q&A and chat will both be open today. If you have any questions, feel free to pop them in the question and answer, the Q&A box, or introduce yourself on chat. We'd love to know who's in the room. Welcome. We'll get started in just a minute. Good morning, everyone. Welcome. We'll get started in just a moment. I love seeing who's in the room. So welcome, welcome. Happy Friday. We'll get started in just one more minute. All right, good morning, welcome. So I think we'll get started. Again, our chat is open. We love you to say hi and see who's in the room today. Our question and answer boxes are also open. So if you have any questions that come up, feel free to put them in the question and answer box. We should have some time at the end of our presentation today to answer a few questions. So please pop them in the Q&A. We'd love to hear from you. Welcome to the workforce, to advocates, stakeholders, childcare champions. We're glad that you're here for the 2021 Alameda County Early Care and Education Needs Assessment launch. We're very excited to have you here. My name is Katie Honaker. I'm the chair of the Alameda County Early Care and Education Planning Council, director of development at 4Cs of Alameda County, and mom to 2 little ones. So thank you again for being with us today. We're so glad that you can join us. Before we share about the needs assessment and officially launch, I want to take a few seconds on behalf of the Planning Council and the entire needs assessment team to recognize the heartbreaking death this week of childcare champion Alameda County Supervisor Wilma Chan. As most of you know, Supervisor Chan was a tenacious, passionate, dedicated leader and advocate for families and children during her tenure on the Board of Supervisors and as a California Assembly member early on in her career. She cared deeply about equitable access to affordable, quality childcare, and her dedication was evident in her work advocating for the passage of Measure C and as a commissioner for First 5 of Alameda County. We send our condolences to her family, her friends, and the entire District 3 team. And we did want to take a moment of silence this morning to honor her and her legacy. So if you could join me in a moment of silence. Thank you so much. So in her honor, the work continues, and I wanted to also say a quick thank you to the incredible team who put this needs assessment together with their knowledge, dedication, and expertise over the last year. I especially want to give a shout out and a huge thank you to the needs assessment subcommittee members who lent their guidance over many, many virtual meetings, and especially to the needs assessment leadership team members, many of whom you'll hear from today, especially Ellen Dekdar, Mara Gobi, Rowena Kamo, Anna Mara, and Michelle Rutherford. Their vision, organization, and expertise resulted in a report that really surpassed my expectation. And finally, a quick thank you to our ECE workforce, our advocates, policymakers, you all, and your unrelenting support of children and childcare in Alameda County. So with that, I'm going to hand it over to Anna and Rowena and the team to officially launch our 2021 Alameda County Early Care and Education Needs Assessment.
All right, thank you so much, Katie, for the introduction and for honoring Supervisor Chan. We are super excited today to share with you the findings from our comprehensive needs assessment for Alameda County. Hopefully we'll be joined a little bit later by our other colleague, Michelle Rutherford, who also worked very hard on this report. I'm gonna go on to the next slide, Anna. All right, so just a quick background and purpose of the needs assessment. It is a core mandate of local planning councils in California to be conducted every 5 years. And it has been a number of years since we were able to complete one in Alameda County. And the County ECE program, along with First 5 Alameda, joined together to leverage our resources to complete this year's local planning council mandate, this needs assessment. Also leveraged some work that was required of quality counts to also complete a needs assessment. Both were completed in December of 2020, and we felt that there was just a ton more data that needed to be included in this needs assessment. And so thus the comprehensive needs assessment, which was just completed over this summer, and the launch, which we are excited to go through today. So the needs assessment, the purpose around is for public education to inform the community, our field on the ECE landscape in Alameda County, to help inform policy recommendations and to support planning, particularly around Measure C and other childcare system changes, for example, TK, and as we build back our childcare supply as a result of the pandemic. Next slide. And we would be remiss not to acknowledge all those who put in so much time and effort and their expertise into putting together this needs assessment. You can see here the many organizations and individuals who put their time and expertise into making this happen. So it was a wonderful effort to be collaborative and to work together on making this happen. So thank you to all of you, and to those of you who had contributed data to the needs assessment.
All right, thanks Rowena, and thanks Katie. A reminder, feel free to put questions in the Q&A box. And so yeah, this took a lot of data, as you can see on this page. A lot of the data is using the Early Learning Needs Assessment tool, which is comprised of census data. And that really helps us get a lot of these tables by zip code. You'll see in the main report, there's many regional tables that we can sort through. We also have data from community care licensing, CDE 801A data from state contractors. Thank you so much for filling out those reports. They were useful in compiling this data. The Resource and Referral Network data, which has a very accurate list of childcare programs in the county as compared to licensing. We know some programs keep their licenses even after they're closed, so we're just really thankful for the work of the network. And then the Workforce Registry, which is for ECE professionals across the state of California. And that has demographic and education information of our ECE field. And we could not have done this needs assessment without, like Rowena mentioned, the many meetings with our community partners and the help in gathering a lot of this data So as you can see there, just the many partnerships that this needs assessment has helped build, and people have contributed so much. So thank you so much, especially the APs, the R&Rs, Office of Ed, Early Head Start. We looked at those reports that you compile, quality counts, again, Title V programs that fill out those 801As. Parent Voices has been a really strong partner in gathering this data. You'll see some survey data down below. And then the Alameda County Emergency Child Care Response Team, you'll see the report includes some COVID-related data, and they've been a key partner in producing that. Okay, so seems kind of arbitrary right now, this big report. So it's 226 pages, right? And here's what it covers, the sections at least. So we have an introduction. Thank you, Katie, as the LPC chair for writing that for us. And then the Alameda County Early Care and Education landscape, which includes some history of childcare in the county, as well as like the funding and the major community organizations, the big players of the ECE system. Then we have a lot on child and family demographics, race, ethnicity, languages, information on homeless and migrant families, license capacity, which takes a look at the available spaces in the county compared to the population. We have subsidies, all the different subsidy types and who's accessing them, the unmet need for subsidized care. Family and parent choice is in quotes because we know that choices are limited with the vouchers and then the number of sites that are open and hours and everything. So there's a lot of data in there, again, from Parent Voices Oakland. Cost of care and affordability. We know costs are way too high and it does not cover the full cost of care. So that is in more detail there. A lot of data on the workforce, which again utilizes the workforce registry data. So thank you so much to ECE professionals for registering on the ECE workforce registry, because that was really useful here. And then lots of COVID data, national data, and then state data, local data, and our main findings. And so the needs assessment slides you'll see will walk through some of the main takeaway points of the needs assessment. We have 10. Okay, so our first one is Alameda County's children and families are extremely diverse. Programs and systems must meet the needs of the diverse population. So as mentioned before, we have some graphics in the needs assessment and then tables. So you'll be able to see the race and ethnicity breakdown by age, by zip code. And overall, you can see in the county, here's the main distribution. And keep in mind that this comes from census data. So the categories, right, like we would want to have a more holistic representation of the races and ethnicities in the county, but this is derived from the limitations of census data. A couple patterns we see is that the 2 or more races category has grown over time, as well as Asian identifying children in the county. And this has a lot of implications for supporting dual language learners in the county. And you'll see here that 79% of children 0 to 12 are children of color. The language diversity is huge. I mean, we have over 52 languages here spoken in the county. And we do have data now on the number of preschool children that are identified as English language learners by the state of California. That term is used by the state of California. So 30% of preschool children in Alameda County are English language learners, and Spanish is spoken by 61% of those students.
I'm muted. So our next finding is that there's an inadequate supply of licensed childcare, and the availability of licensed childcare spaces has been declining. So I think this is something that's not new to our field. Next slide, Anna. So this chart shows the license capacity over time. So we see it from 2007 through 2019. We have it for the total, which is the gray line or the green line, and then by center, which is the yellow line, and then FCCs, which is that bluish purple. So overall, there's been an 8.5% decline of license capacity since 2007. This is mainly driven by the decline of family childcare, which had fallen by 17% over this same period of time and by 34% since 2007. And this is particularly concerning as we know that family childcare offer more flexible schedules, especially around evening and weekend care or non-traditional hours. And that really impacts kind of availability for families to access care that meets their needs. Next slide. And then looking specifically at infants and toddlers, this is a map of where there are childcare deserts in the county. And a desert is defined as a ratio of one licensed space for every 10 infants and toddlers. So you see a disproportionate lack of affordable quality care for options for infants and toddlers. Just wanted to note that, in this map, the darker areas are where there are more children than there are licensed spaces. And given that the definition of a desert is one licensed space for every 10 infants, where we're looking here is actually like much more than that, 40 children for every one licensed space on the lighter end, and then on the darker bluish purple end, 160 children per licensed space. And again, this is for infants and toddlers. And I should also mention that this is based on child population as opposed to child or demand for care. So just wanted to make that distinction. I'm looking at this map. We also wanted to share, this is just an example of some of the zip code level data that we have on capacity for our county. And this really drills down to our neighborhoods, our zip codes, again, looking at the child population for infants and toddlers, and then what the licensed capacity is by family child care and center for each of these zip codes. So in the full needs assessment, you'll see this available for all zip codes in our county. So really just start to see again just the lack of infant and toddler care in our county. And then lastly, we know that the pandemic has exacerbated many of the challenges our field has faced historically. And as we saw in the chart, the decline in capacity existed prior to COVID-19. And we know that many programs were closed or had reduced their capacity during the pandemic. And we don't know yet whether centers and family child care will reopen. As of February 2021, only 75% of our child care providers and 67% of centers reported that they were open. So it'll be interesting to see sort of current data on what that is. And we know that there have been efforts made to mitigate this impact, such as financial stipends and grants to support our providers, and also varying guidance and policies from the state. However, these efforts need to continue, since we know a lot of our programs are still reeling from the impacts of the pandemic. And it's really important for us to continue with these efforts to strengthen the supply of formal care options for our families.
Okay, so our third finding, the current subsidy system is failing to meet the needs of subsidy eligible children birth to 5. Taps into the unmet need data. There's Parent Voices Oakland picture. Okay, so when we're looking at unmet need, it's taking the number of eligible children and then seeing who is actually accessing subsidized care. So you can see here in our infant and toddler unmet need chart, roughly 1 out of every 10 eligible children is accessing subsidized care. So then the 9 other infant and toddlers do not have access to subsidized care, which is shocking. That's a 91% unmet need rate. When we're looking at preschool, it's slightly better, but still not good. Now you see here out of, roughly half of them are not accessing that subsidized care. 46% of eligible preschool age children are not accessing it. Along with that, we have a huge waiting list, right? So those are the children that are receiving the subsidy, accessing care, and then our waiting list of who's still waiting for a subsidy. Now, this data is kind of old. It was done in 2018 by the Early Care and Education Program, Alameda County Early Care and Education Program. And they had actually reached out to, at the time, the 5 APs as well as Cadengo. So this didn't even include all of the contractors across the county, or roughly 30 contractors. So didn't include them, just one Cadengo. And so you'll see here, our waiting list reached almost 7,000 children spread across infant, toddlers, preschool, and school age.
Okay. Our fourth finding is that state and federal income standards do not reflect local cost of living and limit access for families who need help paying for care. So on this slide, you'll see that the income eligibility standards don't meet the needs of families due to the high cost of living in the county. The Head Start, early Head Start income eligibility standard is $21,330. And I believe that's for a family of 3. Yes, okay, thanks, Anna. Yeah, for a family of 3. And for the state income requirements for state subsidized programs is $65,604. So that's 85% of the 2019 state median income. Yeah, again, for a family of 3. And these standards, given that they're so low, lock out many families from eligibility assistance and also create an eligibility cliffs for those who are supported. So, as they're earning more, this doesn't really support them in their efforts to earn more and be self-sufficient for their families, and at a critical time when they still need this support to pay for childcare. So just something we wanted to note that that these standards do not meet the needs of families.
Along with those income eligibility standards, we know we live in a high cost county. So the high cost of living in the county impacts families' ability to afford childcare and the ability of providers to deliver childcare affordably. So 2 issues in one. So you'll see here in this Alameda County high cost of living chart, we're comparing Alameda County to the national average. And as you can see, and you probably know living here, that it's much higher costs. The median home price is 106% higher, 170% higher. Rent is 183% higher. Utilities and phone, 14% higher. Gas, which, we know this is up from when the needs assessment was completed. So, this is 30% higher than. So when you're looking at those eligibility standards, right, the Head Start was around 21,000 in 2019. The eligibility rate for subsidized care was then 65,000 roughly, right? So based on the self-sufficiency standard, an Alameda County family of 4, so I guess we have one more adult, but the standard there is 137,000. So this family is not eligible for subsidized care. And this is just the self-sufficiency standard. That means no movies, no extra events or anything. It's just basic housing, food, transportation, and healthcare and childcare. And just to show that high cost of living, again, in Sacramento County, a similar family would require around 92,000. So it just shows the differences of counties across the state and how the state of California just has this one income eligibility standard rate. And we show Sacramento County here because a lot of legislators live there, right? So, or they have familiarity with the Sacramento area. So then it just kind of shows that comparison. Okay, so here's a shocking one. So if you have this family that has one adult and one preschooler in licensed childcare and one infant in family childcare, oh, this one's in the center and this one's in the family childcare, they would need to make $605,000 in order to have childcare cost no more than 7% of their income. And childcare is considered affordable if it costs no more than 7% of your family income. So raise your hand if you have that much money. Okay, probably not us because we're in the ECE field. Okay, so it's ridiculous. So the inability of families to pay for the true cost of care impacts the child care provider's ability to pay teachers and staff a living wage, right? As a child care provider, you can't be charging families that much, right? And then you cannot pay your teachers as much. It's a public good, essentially, right? There's this issue here that's happening, and then families can't pay that much, and then providers can't pay their staff that much, but it costs so much to care for an infant and toddler and preschooler, right? And school ager.
So we're going to talk a bit about reimbursement rates from the state and the federal government. And the takeaway from the needs assessment is that they are grossly inadequate. I would highlight that since we produced the needs assessment, there is some rate reform action going on at the state, which is really exciting, and really encourage programs to make sure that the R&Rs have their updated rates, so that we expect that there are many providers who don't currently serve vouchers that could serve vouchers with the increased rates. And so we want to make sure that we're increasing family access to sites that maybe they couldn't afford to serve our vouchered families previously. So next slide. And to that point, basically, when you give a family a voucher and the voucher doesn't really pay for the cost of care, it limits families' access. It creates considerable co-pays that our families just can't afford. That's why they're on subsidized care to begin with. And it limits the ability of providers to accept vouchers and challenges the budgets of providers contracting with and in agreements with state federal government. So our Title V contractors basically mostly, unless they have real economies of scale, lose money every day they're providing care, and they're having to supplement that financing. So that's changing in January, and we're really excited about that. And it also exacerbates the problem of low wages for the early care and education workforce. We have a great quote in the needs assessment. We have lots of great quotes in the needs assessment, but a particular one to this point that really what providers are paid translates into wages for teachers and the workforce. And it's just abysmal, as we all know. So this is a slide that shows the comparison. So we did a market rate study locally to understand what the real market is, because the state does a market rate survey and then they don't implement it. And so it's been a long-standing issue. And so partly for advocacy and partly for our own understanding of access to care, we did a local market rate study. And this shows for family child care what the difference is at the current regional market rate survey, which is what the vouchers reimburse, compared to what the dominant market is for family child care for infants and toddlers, and then likewise for preschool. So again, looking forward to some of that getting remedied. But even if we go to what the market will bear, it doesn't deal entirely with what families can afford. Doesn't really help us fully with paying what teachers deserve. So we know that the fact that our country doesn't teach or doesn't address childcare as a public good, and we're hoping that something's happening in Washington to begin to address that and get us in with the rest of the developed world. But this is an issue for our field. Next slide. And similarly, this slide, it shows that the infant toddler state reimbursement rate, which is what the state allows state contracted centers, so the subsidies that are attached to sites, what their reimbursement rate is for infants and toddlers, what the current market rate is. And I would add that for those state contractors, they have like higher requirements and on them than a general childcare operator, because they're serving largely low-income families. So their costs probably are higher and need to be above the market rate. And then just comparing across the board, like what that yellow market rate from our survey looks like versus what the state reimbursement rate was, both for the contracted slots for toddlers and preschoolers, and then in the with vouchers. Oh, this is the great quote from Pam Shaw. Just basically that they're critical for operating and how that translates into wages, and that for our workforce, it's mostly women of color. So this really is an equity issue about how we're reimbursing and supporting the operating costs of our providers. Next slide. According to the federal guidelines, rate setting, voucher rates are supposed to allow access to 85% of the market. We found that that isn't the case with how that plays out locally in Alameda County. The 2020 regional market rate ceiling currently limits access to 39% of Alameda licensed preschools. So that means if you're a family with a voucher, based on the value of that voucher alone, the rates of over 60% of the market are higher than what that voucher will buy you. The fee, we also did some looking at fees. We were hearing about fees. So there's a lot of fees in the process, and the alternative payment agency was allowed to include fees, but only up to that ceiling. So then that means, again, there's all these hidden costs for families that prohibit, we say there's family choice, but there's not really choice if families can't access the options that are supposed to be available for them.
All right, so number 7, the system is extremely complex, resulting in families experiencing difficulties accessing limited choices. Just like Michelle said, there's no real choice if it's a bunch of hoops to go and jump through, and then you can't even afford the care. So the bottom line is family choices must be affordable and high quality for all families. And so this means that we want to look at our mixed delivery system, which includes family childcare, licensed centers, and then our license exempt programs and license exempt caregivers, our family, friend, and neighbors. And so that means we want to make sure that all those options are available, at least in the areas where people want to choose that type of care. We know that centers offer a certain type of care for families that they may choose to go to, family childcare as well, more flexible hours, maybe a smaller setting, license exempt, same thing they often do like after school, things like that. And then our family, friend, and neighbor can be very flexible as this one caregiver that can provide care at someone's home or your home. Okay, so there's some eligibility regulations and requirements that have many barriers. And so kind of what this looks like is extensive paperwork for providers of families. I'll never forget Clarissa from Parent Voices sharing her story of taking one bus and then this other bus to get to Bananas, and then she didn't have the right things or something, and then had to go back and then take the bus again. Like, it's insane, right? You have in-person meetings to confirm eligibility. And as you know, we used to have eligibility every 12 months, and thankfully that has changed now, but that's insane to just have to keep going over again when you're still eligible. And then again, these practices that do not reflect the private market for our childcare providers. So you have these upfront payments. So the voucher is after the care. So you provide all the care and then you get paid later. And then you have unpaid days when the child's not there, right? So you're expecting this child to maybe come in, and if one day they do not, you do not get paid for that, right? So it's hard to plan, especially when you have restricted childcare ratios. You can only have up to 8 kids. If that kid doesn't come, then you're just not getting paid that day. And then you have family fees, which are state imposed family fees. And this creates an additional burden on all levels, right? It creates a burden for families to have to pay that, and then a burden on the childcare providers to collect that fee. And so we'll even see that some childcare providers and sites, they'll just cover that cost because it's just so crazy trying to get these family fees in. Okay, so we're going back to this income. So we're trying to look at this childcare issue and the cost here. So back to that family, you have 1 adult, 1 preschooler and licensed childcare center, and then 1 infant and licensed family childcare home. So if your annual income is that self-sufficiency standard, this is the whole pie. And if so, this is your income, right? Your yellow is your housing. This is the green is the cost for your preschooler. The teal is for your infant. And then you have other costs, right? So if you're a family making that much, still like 50% of your budget is just housing and childcare. And then all the rest is supposed to go towards, all the other things we need to pay for, like health and food and transportation. Now, if you have a subsidy, yay, that's great. Childcare is paid for, right? So housing, though, housing is super expensive. Majority of your income would be this housing. But then you still have to pay perhaps a copay. And the copay is where your subsidy doesn't cover the cost of care at that childcare program. So then you have to perhaps pay the extra funds that it doesn't cover on top. So that's their copay up to 20%. And then you have your family fees, right, that we just talked about. So then you only have 14% left of your income to spend on, again, food, healthcare, transportation. It's ridiculous. Okay, so then if you have an annual income without a subsidy, basically this chart is showing it's impossible to pay for this childcare. And we use the average cost of childcare from our study. So you still have this whole housing, and then you can, I guess, pay for your preschooler, but you just can't pay for your infant. There's no more money left. Okay, so for subsidized families, the reimbursement rate of the voucher further limits the family's choices, right? You say, I have this voucher, you're supposed to be able to go anywhere, right? But that's unrealistic. Many childcare programs do not want to deal with the payments that come after. So they're just like, sorry, but I can't do that, right? And then they have additional barriers of, families face many things here in the county. There's transportation issues, getting to and from places, homelessness, immigration status, language barriers, lack of access to technology. You don't have a computer and your Wi-Fi. How are you supposed to look up all these choices, right? And just expected to go across the county to all the childcare programs that are hard to find. Yeah. And then there's other challenges which further impact the ability to access this care. And so as an ECE system, we must do a better job at thinking of solutions that will support families and support the childcare programs and the alternative payment agencies that are providing these vouchers, right? It's a whole system. And if you only touch on one, right, it may create burdens for the other. So we just have to get together to start thinking about these things. And I think that's one of the main benefits of this needs assessment is we can use this data to shape planning for the future. Okay, so then they Families identify challenges navigating the complex subsidy system and the frustration with eligibility lists. And we have seen that it's a crazy system. And this speaks to the need for a centralized eligibility list. When you have a centralized eligibility list, you can just get on one list to wait for subsidies for various programs and subsidies versus having to go to each of our individual contractors across the county. Again, there's like 30, right? So you have to go to each one on the bus perhaps, or walking to try to get on these waiting lists. And we're in a day and age where technology is much more advanced. We hope that we can work on this issue more. I love this quote from Parent Voices. It was in their study with an interview with an Oakland parent, and it says, "Create a system that when you go up, it uplifts you."
Okay. So our eighth finding will transition a little bit towards our workforce, and that's the early care and education workforce is primarily women of color who are poorly compensated despite years of experience, education, and expertise, and knowing just how crucial childcare, early care, and education is to supporting families going to work and for children to learn. So the ECE workforce in Alameda County is an estimated 7,680 professionals, and that is a pre-COVID number. Between centers and family childcare, it's about 4,085 in the center workforce and 1,281 family childcare professional owner operators and 2,314 staff. Again, pre-COVID numbers. The workforce, again, primarily women, 96%, and women of color. So of those women, 79% are women of color. So, huge equity issues in our field. And that 40% of the workforce is age 50 or older. Slide. Our ECE workforce is pretty diverse and is pretty reflective of the children 0 to 5 in our county. I think it would be interesting to also to look at, within the various roles and levels, sort of what the race ethnicity breakdown would look like there. Next slide. So the ECE workforce is at the core of quality care. Yet folks continue to work long hours and poorly compensated, and many are eligible for forms of public assistance. And so, our strategies to address the compensation issue and workforce supports must happen at all levels of government, private sector, and philanthropy. So really it needs to be a collective effort. And I think, as Michelle said earlier, really looking at childcare as a public good. Next slide. So to the point around, our ECE workforce being eligible for various forms of public assistance, about 87% of the workforce is considered very low income for Alameda County. The mean wage for family childcare and centers, or for family childcare, is about $15, a little over $15, and for center staff, $20.27. And when you look at that compared to the two kind of wages listed below, these are based off of the self-sufficiency standard for Alameda County. So to be self-sufficient, and we're just looking at one adult, the living wage would be $21.88. And then if you are an adult with one child, the wage you would need to be self-sufficient is $46.59. So obviously, just incredibly poorly compensated and very low. Next slide. And so, as we think about strategies to support and professionalize the workforce, compensation is key. I think compensation is really core to that. And then thinking about professional development, it's really important that we consider that our workforce are working long hours and that they have diverse needs. And so when we plan for that, we really need to take into consideration the circumstances of the entire workforce.
So as we all know, COVID-19 disrupted the lives of children and families and the systems that support them, and has exacerbated existing inequities everywhere, but certainly childcare is a sector that we all understood the inequities, and in many ways, now the rest of the country better understands them. So with the impact of COVID-19, we know that 54% of Bay Area households with children lost income during the first 7 months of the pandemic, and 2 out of 3 families changed their childcare arrangements during the pandemic. So lots of disruptions, not shockingly, but so noted. Low-income families and families of color were disproportionately impacted by COVID-19. They suffered work and income losses and were required to continue working, or were more likely to have contracted COVID itself, or impacted with family members contracting COVID. Tangible supports to families, including diapers and pandemic relief strategies for recovery, were and are essential. Childcare resource referral agencies played key roles in distributing goods to families and to our provider community. Next slide.
So the early care and education field showed its creativity and resilience, yet COVID-19 severely impacted the provider community and the systems that support them. So we know that many childcare programs stayed open throughout the pandemic and cared for families of essential workers. And we're continuing to go through all of these mini licensing changes and public health updates, and many were closed and didn't have any income during that time. And it only came later when there were some type of financial supports for them. So the early care and education professionals have been on the front line. They have been able to, many of them, stay open and safe and remaining a lifeline to families and children. And like Michelle mentioned, ECE professionals were already doing this. It just became headline, right, during COVID because they were so needed for people to go back to work. And yes, family childcare in particular, many of them stayed open, more so than certain centers, and cared for many of the families. And also many sites offered remote learning. And so they were still providing the service to families during these days and taking in more school-age children during the pandemic and supporting them with their school requirements and their assignments, which is an extra thing above, right? And Alameda responded to many of the needs. We created this partnership. We'll talk about it a little bit later, but the Alameda County Early Care or the Emergency Child Care Response Team, which has been a huge key partner, and then other major county community organizations, which have been able to provide resources to the fields. And, like the sentence says here, it has been too little and too late for many. So many programs have closed. We already know that, as you can see in that first graph we went over, the capacity was already declining. Our license capacity was already declining pre-COVID. And now we know that many sites have closed and it's even lower now. So again, this is an exacerbating issues, right? Pre-COVID, teacher shortages were huge and substitutes were so hard to find. We've been hearing that over and over. And now with COVID, it's even harder to find ECE professionals to work in different childcare programs. And yeah, as cohort limitations were lifted in April, many providers struggled with finding staff. And as I heard from some programs too, the unemployment could pay for more than you would make at the childcare program, right? So we'd rather do that than have to go through all the stress of caring for children during this time. A lot of the supports and trainings shifted to virtual, which has actually shown much more attendance. There's been high attendance rates at these virtual meetings and trainings. And technology, both internet and hardware, has been extremely helpful, able to provide some laptops to family childcare providers and just more internet, because during this time when many things have shifted to virtual, this meeting as well, it's been critical to access these trainings and meetings. And family childcare express an increased need to be connected and supported. My mom was a family childcare provider, and she definitely had this feeling when I was growing up of just like sometimes feeling alone. And so having that connection is critical. And during COVID, when you couldn't have that, you couldn't maybe meet up with another family childcare at the park, right? I'm sure it was a hard time for many. Okay, so this is huge. So during the fall of 2020, we estimated that the Alameda County childcare field was losing more than 18 million per month. Per month. This is due to closures and then the under enrollment. So less children were attending the childcare programs because of COVID and cohort restrictions. So this is just crazy, right? And then we have, some grants and supports that have come out, but I have not seen any reach that level of financial support. And this is just our county. So many systems have been strengthened through partnerships. I saw many ECE partners really come together to offer support. So this is our Alameda County Emergency Childcare Response Team. There's been more communication to the ECE field that I believe we all want to keep going. They've been providing regular webinars and check-ins with Department of Public Health and community care licensing. There's been FAQs and guidance. Many were translated. In fact, I remember when the pandemic just started, we were searching for materials in Chinese and Spanish, and there were hardly any. And so we actually translated much of the resources ourselves, thanks to our awesome partners here. And we definitely wanted to announce all of the financial relief opportunities as much as possible to the field. There's been a coordinated distribution of personal protective equipment and technology during this pandemic, and then health consultation and behavioral health consultation. So you may have heard the term Health Heroes, an awesome partnership with Samuel Merritt University, where they have student nurses that go to the childcare programs to support with tips and guidance during this time, like hand washing and other supports, wearing your masks, things like that. And then also hosted at Hively and Alameda County Office of Ed, there were 2 vaccine clinics for childcare providers and their families.
All right. So thank you for being with us as we went through our 10 major findings from the needs assessment. So in terms of next steps, this recent fiscal year 21-22 state budget reflected some changes to the the subsidized reimbursement rate ceilings for providers, income eligibility standards for families. And so just want to note that the data in the needs assessment did not reflect these changes. As we were putting this together, this was prior to the budget. So since then, things have changed. The full report is available on the First 5 Alameda County website. So we can put that link into the chat so you all can access that. And the report will also be added to the Alameda County ECE Planning Council website through ACOE. And on the website, this recording will also be made available, as well as the slides. And the slides, we also have those translated in Spanish and Chinese. And so those will be posted as well. The next webinar that we're going to do is sort of a deeper dive into the data that was included in the needs assessment. So if you or someone you know really loves just digging into the weeds of the data and want to know, how to how to use it, how to pull some of the tables, please register for that webinar, which is going to be held on December 3rd. And we are in the process of developing the executive summary, which will be a very, very truncated version of the 226 pages of the needs assessment that's in development now. And we are also going to be working on a little bit later city profiles. So a lot of the data that was in here just very tailored to the cities in our county. So that is to be developed. So again, just thank you to all of you for joining us today. And we wanted to save some time for questions. If anything has come up for folks, I think we can probably, folks can raise their hand and I can unmute you. You can ask your questions or share any comments or thoughts, reflections on the data that you've seen here today, or just about the needs assessment in general.
And I see the question here is sharing to your ECE class. That's an awesome idea and totally love that. So we'll provide the recording on the website, which will show you at the end how to access it. And I think Katie put it in the chat as well. Yeah.
Okay, I see Maria Gomez and Dolores with their hands up. I'll go to Maria first. That's who I saw first. So I'll go ahead and unmute you, Maria.
Great, thank you so much. As a family daycare provider, you guys were hitting the right points and the right things that actually is happening to us. And all the help that we got from you and from the community and also from the own parents. When this hit us, we were unknown. We would just need to wake up the next morning and help the parents that they work in the community, that they are essential workers, that they need to go to work the next day. And then as every day, we took it as a new day, a new thing. One of the things that I wanted to say, and then maybe I can speak from all family daycare providers, we're going through a lot of different things, and it hit us economically really bad because as a family daycare providers, we cannot stay later. I already opened from 7:30 to 5:30, and I also have my own family that I need to take care. And then some parents ask me if I can open up a little bit earlier than that and stay open a little bit later. We're already working 10 hours a day with hardly any break. And the way that we're reaching out to, I haven't, and I know a lot of providers haven't changed their rates for years. And as we go to the grocery store right now and try to buy the same amount of money or the same amount of groceries that we used to do before, we ended up just buying half. We still need to buy the groceries because I provide fresh meals for my kids. But it hit us just right in our budget. And also we have our own bills that we need to pay. And then some parents, you keep them like, okay, you can pay me later, ended up not paying you later. And then would keep us take us in disadvantage or in a thing that it was hard for us to keep surviving. But we're also trying to help as much as we can. And then luckily I have parents that they work in like sheriff. I have a sheriff family. Then with this hit us, they said, okay, if you stay open, I will bring another parents that they have kids too. And we try to fill you as much as we can. And we can pay you a little bit extra so you can stay open and survive. And so all these things is helping us. But the other thing that we have to think about it, not one thing feed us all. We all different care providers. We all have different needs, and we all open different hours, and we all have different things to afford to or things to provide to the parents that we serve and to children and their family. I'm lucky to say that I'm being quality counts in 2006, and then I've been helped a lot from them, and then I do curriculum for my kids and all that. But we need to help a lot of providers that they're just starting or they're new in here, so they can step up to the step that we need to make sure that we all provide quality daycare for the other families. I'm speaking too much, I'm sorry, but that's it. That's all I wanted to tell you. Thank you so much for the hard work that you guys doing for us and stepping up for us. We really, really appreciate it.
Awesome. Nope. I think, thank you, Maria, for everything, and for all the other providers that are out there. Thank you for all of your work, your flexibility, and just everything that you're doing for families and children, especially now during the pandemic. It's so needed. And thank you again also for lifting up the economic impact to providers, and just that all of our providers have different needs, and that this has really impacted us, our field, in a really significant way. And thank you. Let's see, I see a couple of comments in the chat. Just wanted to uplift those that we need food. We need food support too. Grocery is expensive. It's sad that our country does not have a food program of its own, so we don't get extra grants or produce boxes that food programs get. And yep, so the link to the report was shared in the chat. We can share it again. And then perhaps also this was the link to First Five's page, where the slides and the recordings will also be posted. So we can share that link as well. So I think I see someone's hand up. Oh, Heidi, I see your hands up. I'm going to go ahead and unmute you.
Hi there, I'm another FCC provider. One piece I was thinking about when you were talking about subsidized care and payments for children's missed days is I know a lot of providers have been struggling with their illness policy during the pandemic. Much of the guidance they've been receiving, or we've been receiving, is have children have no signs of contagious illness. And I used to joke, like, if I excluded children for runny noses, I would never have children in my care. But that's like kind of what's happening sometimes. So I'm just curious about the impact that's going to have on providers in terms of, obviously financially, for missing those payments for excluding children with runny noses, and also for health, because we know that runny noses could be a sign of COVID in young children. So just a piece I kind of wanted to throw out there and hear some thoughts on. Thank you.
I can speak to that a little bit. I think that's a really good point that's really missed when we even do some of these calculations, like mentioning the 18 million lost in the field. Like, that's taking the kids who are enrolled at the program, but right, like, enrolled doesn't mean they're showing up to care. So that's just a really good mental note for me. Like, this is even a greater underestimate of the loss that everyone's experienced, because enrolled does not mean you're receiving payment and have a kid there. So just thank you for uplifting that.
And I see a couple of questions. McKinya had shared, she placed a couple of questions in the chat. One, how will this needs assessment impact Alameda County? How will this information impact the future? And who will this information be shared with to create change? And the second question around Measure C for the county, and how quickly will these changes made, seeing that there is some funding coming into California and particularly our county. I think in terms of how this information will impact our county, I think the purpose of the needs assessment is to be able to provide our field with with data on the landscape of our county. And I think a lot of the data shows, where there are needs, where we need more investment, and wanting to be able to use this information for folks who use it for advocacy purposes. We know there have been a couple of groups that have used data from the needs assessment to advocate for ARPA funding for providers. I think this data is available to all of you, to all of our organizations, to be able to share and to provide data to back up our stories, and the experiences that we have, to show that it's not just a couple of providers, it's actually happening to our entire field. And so really being able to come to use this needs assessment as a tool to provide more information, some data to back up the stories that we have and things that we're seeing in our county.
And I would say, there's many specific examples in the needs assessment of where it's like, this should be driving how we're thinking about planning. Like, what about infants and toddlers if the entire county is a desert for infant toddler licensed care, and most families with an infant toddler could support that? Then, what's our strategy around that, and how do we advocate with the state so that when facilities dollars are coming down next winter and spring, that they think about infant toddler care, because it's not just a problem in our county. And so there's lots of ways I think you could go through and see different places, but that's what I think, getting our arms around a workforce estimate. So when we say, like, as we're training the workforce and supporting the workforce, who are we reaching, who are we not reaching? If you don't know what the universe is, we can't really understand, how well we're doing or not doing in reaching them. So it's both a planning tool and advocacy opportunity, and really to level set for all of us the cross-sector issues in the field, so that we're collectively supporting all of the parts of what need to happen. And then I know Makia had put in a question about Measure C, and I did answer it in the Q&A, but or at least lightly. But certainly for us, understanding the baseline about what was happening in the field is really important as we plan going forward with Measure C in terms of priorities and unmet need. And I mean, I can tell you, if when you look at those unmet need pie charts, if we just paid for the children that have the unmet need, we wouldn't be able to reach all those families. There's not enough money, even with the big amounts of money that are forthcoming for Measure C. So we really need that investment at the federal level, state level, local level, and Measure C would really be supportive in that way. And I know even Oakland is still looking at their Measure AA. So I think when we talk about public good, that we are talking about how do we do public investments that support this, so that it's not all on the backs of providers and families.
Thanks, Michelle. And Gabby, I see your hand up. Oh. You should be able to unmute now. Oh, okay. You didn't need to. All right. Are there any other questions from folks? I see Shruti has her hand up. Let me go ahead. You should be able to unmute, Shruti.
I thank you so much for this. It's always good to see the numbers for the pain we are going through. But like somebody said in the chat, 16 days of sick leave, that's not enough, especially in kids, because runny nose is a symptom, cough is a symptom, vomiting is a symptom. The kid needs to go back home. We can't keep the kids at home at the daycare with other kids if they have those symptoms, So in a way, the state is asking us, we'll just pay you for 16 days. If after that, what are we supposed to write on our time sheets? COVID sickness, present, absent, and then we don't get paid. Maybe that is one of the reasons why a lot of providers are hesitant to take subsidized childcare kids, because we don't get the full payment. That's the same with aftercare kids, after school kids. I had to drop a kid because I was just being paid full part-time, not full-time for the kid, even though the kid was here taught 30 hours a week. So it's frustrating. We want to help as providers, and it would be nice if somebody could take the voice forward and say, this is what we need. This is what the providers need. And that's why I said I'll unmute and speak to you guys about this, that we need to have more than 16 days. We need to revisit the subsidy payments, because that's not enough. And we don't want providers to start dropping off.
So thank you for that. And I know with Katie here, and then those of us who sit on the policy committee for the Planning Council, I think, the Planning Council's working on its policy platform right now, and things to work on, and lifting up that issue on behalf of providers, I think is helpful.
Okay. Are there any other questions in the Q&A, or folks have any questions? Feel free to put them in the chat, or if you're comfortable speaking, you can raise your hand and we'll unmute you.
Yeah, and I really encourage folks to go to the actual document so that you know what's there. I think we get a lot of questions about the field, and a lot of the answers are in the needs assessment. And so to actually familiarize yourself with it, so that when questions come up for you, whether it's demographics or actual providers, or what does it look like in your neighborhood, those are all, there's all sliced and diced data that can be available to you.
Yeah, and we do have Sume who would like to make some comments. So Sume, you should be able to unmute yourself now.
Hello, everyone. I'm Sume from the Bananas. And to add to what providers have been expressed their challenges and concerns about these whole subsidized program and process. So I do feel, I work with daycare providers a lot. I'm quality improvement coach and supporting their work. I really see the challenges and struggle from both ends, from parent and providers. And for somehow, and the state system, the subsidized program, the system, and also the needs of families still very parallel. And I don't really see this across line saying that, okay, we get to the point that we have, more, compromise in the system. I don't see that, and for various reasons that some of the providers have already been expressed. At the same time, I do think if at the county level, in terms of the small logistics, it can make a big difference. For example, the timesheet submissions, and providers have to be able to be really on time and physically go to the local R&R and submit the paperwork, versus a lot of things being done also digitally right now too. And then if there's any signatures missing, the mail have to send back to the providers, and then the providers have to ask the parent to stay and to write that one missing signature. Signatures are important, but is there any other ways that could be more, in terms of cutting the time of the parent and the providers? Imagine if a provider not just have one subsidized childcare child, what if they have variety, like 3 of them or 5 of them, even though they wanted more, if the fact that, oh, the more I have, the more work in the background I have to do. So it's also their time concern, and really adds the burdens. And if the policy is really in place, I think in terms of small logistics like that would be able to be helpful in terms of cutting the time and making the system more streamlined. Thank you.
Thank you for sharing that. And again, just uplifting the challenges and then also the realities of our providers, and that they don't really align with what's required in the subsidy system.
I see a comment from Trish about the operating budget for a private pay center and how she had to limit subsidized children because the rate was so low. So that is an example of, with the rates going up in January, really hoping that providers don't have to ration that in the same way, that the rate better matches what your center costs are.
All right. If there are no other questions, I just want to, oh, go ahead. And were you gonna?
You can show where the needs assessment is really quick.
Oh yeah, sure. Yeah, thanks, Anna.
Yeah,
Thanks, Anna.
I can exit here. Okay. All right, so I know the link is in the chat. Thank you, Katie, for putting that there. I just wanted to show you, in case it's lost or something, you can always go to first5alamedacounty.org. You'll see Supervisor Moma Chan there. And if you scroll down, it'll be the first bubble here that has the Alameda County Needs Assessment. You click on the read more, you'll find our page here and you can access the full report here. So this is what it looks like. It's so exciting. And here's the full giant 226 page one to share with you. Really excited about it. So thank you so much.
It took longer to birth than a baby.
We were commenting earlier that seeing it in this way just really makes the data come to life, and just to see everybody's work and collaboration and input and into this document, it's really exciting and amazing to have it on there. So yeah, so thank you.
So use it.
Yeah, so use it, please access it.
Before we wrap up, I just wanted to say, and I know you're getting a lot of love in the comments, but thank you to you, and Anna to you, and Michelle to you for spearheading this 226-page child. It really, I mean, just in the quick morning meeting we had today, it really opened up some great conversation, and it's a good example of how using it as an advocacy tool with data behind it can be really powerful. So I encourage everyone to join us for the deep dive. If you're a data nerd like myself, I'll be there again. But wanted to send a quick thank you to you and the First Five team for all of your support with the Planning Council and getting this needs assessment birthed. So thank you.
Awesome. Thanks everyone for joining. And as Katie said, join us for the deep dive on December 3rd. And check back on the First Five Alameda website for the report, and also for the webinar recording, as well as the slides if you want to go back to that. And feel free to share those as well with your staff, or if you're, if you teach students, like, please share that as well. We'd love to see this go far and wide in our county. So thank you again, and enjoy the rest of your day and enjoy the weekend. Much appreciation to all of you. Thank you.
Thank you, everybody.
Bye all. Thank you.